So I call psychosocial oncology the science of caring. The fear of dying is omnipresent for every patient diagnosed with cancer at one point or another. And we're trying to put that in context of how can we improve their quality of life, not only physically, but also around the psychological issues. That could be therapy, it could be talking therapy, it may be related to finance, to parenting a child, or the sense of isolation. And so we try to manage that along the continuum. It's to help patients live the best possible life they can following a diagnosis, treatment, whether it's recurrent disease or even at end of life.
What isn't often known about patients is that no matter what your stage of cancer is, you are going to leave this process with trauma. And everybody's so busy telling you how brave you are and what a great job you're doing, but no one sees what's going on inside, the storm that's happening inside. Because whether you come out of treatment or you're still in treatment, every single day you have to deal with the unknown of recurrence, right? You have to learn to live with that. It's like a roommate nobody wants. And for me, that therapy gave me permission to start living again and not live in fear.
Calgary researchers were the first to show that psychosocial distress affects nearly half of all cancer patients. Because of the seminal work by our own Dr. Barry Boltz and his team, cancer hospitals around the world now routinely screen for distress. In fact, it's considered the sixth vital sign in cancer care. This shows how patients directly benefit from the advanced psychosocial care our research informs. Calgary's partnership with Alberta Health Services is what makes this happen. We're uncovering the most effective approaches to psychosocial care for young survivors in partnership with Alberta Children's Hospital. And we're recruiting the best of the best to Calgary to further this work to improve the patient experience. This will only grow stronger when the Calgary Cancer Centre opens.
Community support is absolutely critical to supporting psychosocial oncology, and it's really what we're talking about today. Canada's first philanthropically funded research chair in psychosocial oncology, the Enbridge Chair, was established in 2007 here in Calgary, so it's been going on for 15 years. And current work by the chair includes understanding how to use supportive therapies like yoga and meditation to help cancer patients heal. So through Philanthropy, we've advanced internationally acclaimed work in psychosocial oncology and attracted new federal dollars to propel the work further with supporters like the Daniel Family Foundation, the Button Family, Alberta Cancer Foundation, Enbridge, and new partners. That's what will take this field of cancer research and cancer care to the next level.
Our world-class research and education in psychosocial oncology at the University of Calgary are driving better care. Psychosocial oncology is about treating the whole person. It considers each individual's unique biological, social, economic, and psychological needs, tailoring treatment and providing supports to improve outcomes for patients and their families. This targeted and proactive approach can help mitigate further cancer-related challenges, reducing overall healthcare costs and allowing patients and families to return to work more quickly and live their lives more fully.
This very generous Daniel Family Foundation gift is really going to help the psychosocial and, in fact, beyond psychosocial within our cancer patient populations, their families, and our staff. The new cancer center itself, in fact, provides a great venue to start to expand some of the areas that, although we're known nationally and internationally and within psychosocial circles, allows us to really start to concentrate on some of the areas such as our elderly groups, our new Canadians, with our Indigenous communities. The other thing that the new building allows us to do is it's really a magnet to bring in all of the various areas within psychosocial into one central area that research and clinical activity can really benefit our patients, their families.
Whether you're giving time, whether you're giving money, it's important to help others out. The real inspiration for being involved with psychosocial oncology came from my mother, and she was diagnosed with cancer in the late 1970s. But she believed very much in holistic approach to health, and that it wasn't just healing the body, but it was healing the mind and the emotions. We've been long-term believers in how that emotional, mental, and support system can play a role in your physical health.